Dr. Wall, 1 minute. Okay.
Sure.
So once again, my name is Ramki. I'm a physical therapist at RVA Physical Therapy and Sports Rehab. And I wanted to introduce Dr. Wild to everybody. So Dr. Michael Wild is a holistic doctor specializing in cellular inflammation and detoxification, and also uses his 30 plus years of experience in chiropractic, functional medicine, and biohacking. Biohacking is something new that Dr. Wild has had it in his clinic, and he's located off of Patterson. If I'm right, I'll say this right. Dr. Wild's Chiropractic Medicine, is that the clinic name?
So not exactly.
Okay, that's why I was asking. Okay.
So actually, there's three kind of distinct businesses under one roof here.
Okay.
Wild Chiropractic Care, Wild Wellness Consulting, which is my functional medicine, and the Biohack Zone, which is biohacking.
Biohacking. Okay. And basically, the role of biohacking is to prevent, stop, and even reverse the 5 top killers in United States, which is mainly the cardiovascular disease, diabetes, cancer, Alzheimer's, which I need some consultation, and autoimmune dysfunction. And basically, a little background about him. He graduated his pre-med program and finished his chiropractic doctorate from New York Chiropractic College in 1991, and has been helping people since then through his private practice, which Dr. Wild just mentioned. And once again, his biohack zone is a unique cellular health center in Richmond off of Patterson, which uses minimum time to get you to maximum results in decreasing stress, increasing strength, optimizing appearance, and enhancing health. So I presented to Dr. Wild. I'm going to mute myself, and Dr. Wild, you can take over, sir.
Okay. Thank you, Ramki. I appreciate that. I know that was a mouthful, but as Ramki said, I'm a little bit of a jack of many trades, but I'm a specialist at cellular inflammation and detoxification. So I've learned over the 30 plus years I've had in practice that there's quite a different combination of things that can affect people, but it all comes down to some fundamentals that are kind of universal. So I focus on those things. And today we're going to put a little bit of that kind of spin, a little functional medicine spin, a little cellular healing spin on the topic of how do we protect ourselves and defend ourselves from viruses. So we're going to be following along a presentation I've created for this purpose that I've given to other groups before. It's actually an hour-long presentation. So I'm going to give you a warning now. I'm originally from New York, so I'll speak up to 60 miles an hour with gusts up to 100. Okay? And being from New York, I'm not Italian, but I talk with my hands. So watch out. There might be like a 3D kind of thing going on here, but I'm going to try to get as much information across to you in about a half hour as possible. If you stick with me through the whole presentation, at the end, I'm going to give you information about how you can actually get a copy of the presentation itself, so you can actually get information about the slides I skip over, just because we want to hit some things that you probably don't know, not what you already do know in today's presentation. So as we move along, what I'm going to do is I'm going to bring up my presentation. You guys will see me, I believe, as we still go along, and I'll just go ahead and talk. And this is the weirdest part because I don't see you, so I'm just talking to my computer and I sound like a crazy person, but that's okay. All right. So let's see if we can go ahead and do that. So I'm going to minimize this view and let me share my screen. Give me 1 second. Takes a second to do this. Okay, and then let me get rid of this. All right. Okay, let me just get a little bit more here and get one more thing off of my screen, and we should be good to go. All right, so a little feedback. If anybody can unmute for a second, can you all see my screen?
Yes.
Okay, awesome.
Yes.
Very good. All right, so let's move right along. So some of the things we're going to talk about today, I want to talk about exactly what a virus is and the 3 ways to stop it. I want to talk about who is actually at most risk to any kind of virus, which might be different than who you think it is, and why. I want to talk about which 4 nutrients are the most important when trying to defend yourself from a virus, and which 5 things are paramount in helping your immune system fight off any virus. So we've got a lot to cover, so strap in, here we go. So as I said, today's presentation is CONTRA virus, natural methods to protect yourself from any viral illness. And Ramke already gave you a little bit of background information on me. I did my undergraduate work at Boston College, got my degree in psychophysiology there for the mind-body connection, understanding particularly how stress affects the body and vice versa. I got my chiropractic degree at New York Chiropractic College, and I moved down here to Virginia from New York almost 30 years ago. So that doesn't only make me a Yankee, I never went home, so it makes me a damn Yankee, as you guys know. Moving forward, let's talk about what a virus is. I find that when I speak to patients about viruses, most people don't really have a clue what a virus really is. And actually, people typically ask me, how can I kill a virus? I said, well, it's going to be a really tough job because a virus is actually not living. Not in the sense that we give to what we believe to be living, which is living objects have to have a cell wall, and viruses don't have a cell wall. So what's interesting about them is they're intelligent, and they can take over living structures such as other cells, but they're not living by themselves. They're actually tiny bits of genetic material wrapped in protein envelopes and often a layer of fat or lipid, which is capable of hijacking other living creatures' cells, taking over those cells for their own evil purpose, and turning that cell into a virus factory to make more. So that's what a virus is in general. Now, of course, what we're all concerned about, the elephant in the room, is the particular virus we're all dealing with right now, the coronavirus. So we're going to talk a little bit more specifically about that right now. So the coronavirus is, as you've probably heard a million times over because we get bombarded by the media, is called the SARS-CoV-2. It's a close relative to the SARS virus. If you guys remember that, just a little while ago, we thought the world was going to end because of SARS. And thank God that kind of petered out all by itself pretty quickly. And let's keep our fingers crossed the same thing happens this time around. Both the SARS virus and the coronavirus, the COVID virus, is known as a spike protein, except this one has a very different spike protein from SARS, which is why we call it a novel or new coronavirus. The virus is thought to spread through bodily fluids and, as we know, unfortunately, through the air as well. That's why it can be transmitted. That's why we're asked to wear masks. So if we cough or sneeze and get that phlegm onto somebody, we could transmit that. Most people don't realize, however, though, you can even transmit that simply in the water droplets from your speech. And those water droplets, which are micro droplets, you cannot see them, and they'll stay suspended in the air from anywhere from 10 to even 20 feet away for up to 3 hours. So it's important not only to wear a mask to not spread that, but also if you're worried about actually contracting that, we wear masks for that purpose too. But the reality is micro droplets can still kind of get around that mask, and they can even go into your eyes. So you really can't escape it. So we have to come to the realization that we're all going to be exposed. We're all going to, at one point or another, take that virus into our bodies. And the difference is, will it beat us or will we beat it? Okay? So we're going to talk today about our best method of approach to beat it and not let it beat us. All right, so let's talk about the virus itself. So if you look at that ball that we've all seen that picture of with those little spikes, that spike protein we're talking about, that ball itself is actually made up of a layer of fat or lipid. It has the spike proteins coming off it, and those are where that virus will actually attach to your cells using those spike proteins to latch on. But in the core of that, we have this genetic material. And specifically in this case, it's what we call RNA. You might remember back from high school in your biology classes, we have genetic material inside our cells called DNA and RNA. The DNA tells the cell what its job is. The RNA tells the cell how to reproduce or replicate. That's what the R stands for. Now, in this case, this particular virus is full of RNA strands. Now, what happens is, let's take a look at a normal animal cell. This is what our cells look like on the inside. Our cells are circular, and here we have a cross section, so we've cut a little bit of away, so you can actually see what's going on inside that cell. So the outside of the cell is covered with what we call an external membrane. It's the skin of the cell, just like you have skin covering your body. Now, inside your body, you have lots of organs that are keeping you alive and well and functioning. And inside our cells, we have tiny organs called organelles. And they're all these little guys that we see over in here. And they keep the cell alive and functioning. Now, at the center of that cell, we have something called the nucleus. And inside the nucleus is where that genetic material, our DNA and RNA, is found. But the nucleus itself has its own membrane to protect it, like its own second layer of skin. So this is how we work. We have information that comes in through special channels that are opened up that go through our external cell membrane so nutrients can get in and signals from different hormones and neurotransmitters can get to that cell and give that cell information about what it should be doing to keep us alive and well. Once that information gets inside, if it's going to be affecting the genetic material, it also has to get through that secondary membrane into the nucleus itself and get into the DNA and RNA. So what happens in the case of a virus, or in the case of the coronavirus? Well, here, this cell is represented by this yellow guy here. And here comes the coronavirus. It attaches to the outside of that cell membrane, and using its spike proteins, it opens a door. And that allows the virus to enter the cell. Once that virus has entered the cell, it gets inside and it breaks down its components to release that central RNA that we talked about before. That RNA then worms its way into our nucleus and binds to and replaces the RNA that's in our cells itself. When that happens, then our cell becomes a viral factory, reproducing more viruses instead of more of itself. Eventually, those virus particles begin to reform themselves back into the virus, and then that virus gets expelled from the cell and goes off to infect other cells. So one goes in and many go out, and that does the same thing to another cell, another cell, another cell, and so it spreads and spreads and spreads. Now, when that virus leaves the cell, oftentimes that cell dies. This is how a virus can beat us, and we can succumb to the virus and die from the virus, is when the cells start to die in too great of a number to be able to be reproduced as a result of the virus taking over. In the case of the coronavirus, the weakening of our immune system in fighting that coronavirus and the inflammation it creates also leaves us open to other infections from opportunistic bacteria. And so those bacteria then causes secondary pneumonia, and the pneumonia fills up our already inflamed lungs, and that's how people actually die from coronavirus. So we're going to talk a little bit more about that as we go along. Let me go back. Sorry about that. Went a little too fast. So what are the symptoms of coronavirus? Well, sometimes there's a runny nose. We know there's a dry cough. Sometimes there's a sore throat, and there always seems to be a high temperature. We know it's spread from person-to-person contact and through the air. And again, it's the pneumonia that usually kills people. Unfortunately, you virtually drown in your own fluid. Not a lot of fun. So let's talk about what we can do to protect ourselves from that. First of all, how do we know that's not just the flu? Well, some of these symptoms are overlapping. Fever, cough. The difference is in coronavirus, you get shortness of breath, which you typically don't get in the flu. With the flu, you typically get a headache, which you typically don't get with coronavirus. The symptoms of coronavirus take anywhere between 2 and 14 days after exposure to materialize, and we seem to feel it's more like 10 to 14 days, where the flu is just 1 to 4 days. So if you came in contact with someone who was sick, and within 1 day you're sick as well, it's likely more the flu than it is the coronavirus. And how we tell if it's just allergies? Well, if you're sneezing, it's allergies. Sneezing is not a symptom of either the coronavirus or the flu. If you have itchy, red, or watery eyes, that's more a symptom of allergies. Now, they are saying that some red eyes can be a symptom of coronavirus as well, but it's much more likely to be allergies. So, what's going on in the world right now? We're trying to have the race to create the cure, right? So we're working on antiviral drugs, and there was just an announcement made that one particular drug was showing some hope in the sense that it's cutting down the symptomatic expression from 14 days to 11 days. So you end up being able to fight this off a little bit faster. And that's actually quite important because it's in that later week, those later few days, where the system starts to crash. And that's, of course, where most people die, is right towards the end there. So things that can help us fight this would be better. So are drugs the answer? Well, the problem is antiviral drugs have lots of side effects, such as we see here: nervousness, poor concentration, nausea, vomiting, diarrhea. Great, I could deal with all that if it saves my life, right? But the reality is it also, most of these drugs cause breathing problems. And what is the problem that we're having with COVID-19? Breathing problems. Do we want to take a drug that causes more breathing problems? Absolutely not. How about Tamiflu? We've been using that against the flu. It's an antiviral drug, and one of the side effects on the package insert is it can lead to death from respiratory problems. That to me sounds like a no-brainer. We kind of want to stay away from that. So what about this vaccine they keep talking about? Well, we know there is no vaccine for the SARS virus right now, and it's unlikely that any vaccine will be created anytime soon. It'll take at least 12 to 18 months, and that's with fast tracking it. Now, this makes me pretty nervous, because we already know there are quite a few problems with properly testing for vaccines, and we end up having quite a few side effects because they don't get tested long enough for safety and efficacy. Now here we're fast tracking this vaccine. So I'm a little concerned about that. It's going to make it a little bit more dangerous than your average vaccine. Now, not only that, but spiked protein viruses like SARS, like the coronavirus, the COVID-19, have been found to be particularly problematic because they make it very difficult for the immune system to respond to a vaccine to that virus. As a matter of fact, in all the vaccine studies done for the SARS virus, which they did for quite a long time, found that animals vaccinated with that vaccine had a very high mortality rate. So that does concern me. So I'm a little concerned that perhaps we should not have our faith in a vaccine, but rather we should take proactive steps now to try and make some differences for ourselves. Let's talk for a moment about who is dying from this, okay? Now, we know that anyone can potentially die from this, of course, and now that they've made the diagnostic criteria saying that all deaths are a COVID death until proven otherwise, and they don't have enough time or resources to do autopsies, so they can't prove it otherwise, it seems to me that our statistics are going through the roof, which is a very scary thing. You hear new numbers every day. 4,000 more people died. 4,000 more people died from every cause, not from COVID-19. They may have died with COVID-19, but they didn't all die from COVID-19. So I'm only telling you this because I don't want you to have such fear that we're getting blasted and bombarded by the media every day, giving us new numbers, and it's doing nothing but instilling more and more anxiety and fear. And we're going to talk in a minute about why it's so important not to let that overcome your psyche. Okay, let's get back to what we were just talking about. We're looking at the age groups of those who do end up dying. So hospitalizations, we can see that obviously as we age from our 20s to above 80, we have the greatest percentage of hospitalizations. Well, that simply makes sense, doesn't it? The older we get, the more our immune system starts to weaken, and we'll talk more about that specifically in a moment. So we don't have the best chance of fighting off right away, so we end up in the hospital. Now, we do see that a greater percentage of those as we get older end up in the ICU as well, and then we see our case fatalities really jump. So in that 20 to 44 age bracket, we're seeing the fatality rate to be around 2%, and that's an overestimate. Certain estimates make a statement that it could be as low as 0.2%. So this really is much smaller than we think it is relative to the number of cases. But we do know that as we get older, look at those who are over 85, it jumps up to 10.5%. Now, even if that's an overestimate, relatively speaking, it's a tremendous increase. So we obviously do see that the older we get, the more likely we are to actually die from this. So why might that be? Well, as we get older, our cells go through a natural process of weakening. It's called cellular senescence. And in the case of immune cells, there's specifically something called immune senescence, which is the age-associated dysregulation and dysfunction of the immune system. And what this does is impair our protective immunity, and get this, it impairs the ability of the body to even respond to a vaccine if it were even the most perfect vaccine in the world, if it had no side effects, if it had no danger, it worked 100% in certain people. As you get older, it will decrease your ability to have a proper immune response to the vaccine. So even for our elderly population, those who are most susceptible, a vaccine is really not a great choice. So what can affect this and accelerate immune senescence? What can make our immune system weaken? Well, there's quite a few different things. Some things that happen from inside the cell, called cell intrinsic factors, and things that come in from the outside, environmental extrinsic factors that have an impact on our cells. I'm just going to pick on a couple of things here. One thing is telomere shortening. Now, telomeres are on the end of our DNA strands, like the plastic on the end of a shoelace. They prevent our DNA strands from fraying or unraveling. Now, as our cells normally age, every time a cell reproduces, it gets one little slice taken off of that end cap, off that telomere. And as it gets to the end of that end cap and that telomere is completely gone, then the DNA unravels like your shoelace that let go, and the shoe falls off, the cell dies. So cells can die as the telomeres shorten. So anything that shortens the telomeres is going to impact us. And there are certain nutrients that can lengthen telomeres and protect us. Now, on the other side, environmental factors, the one thing I want to point out here is a pro-inflammatory environment. Anything that inflames our cells is going to increase our immune senescence at any age. So this is one of the things I think is a big factor when they talk about younger people dying from this and saying, but he had no comorbidities, he had no other factors, no heart disease, no diabetes, nothing that we know of that would have made him more susceptible to die. Well, he may have certainly had immune senescence from pro-inflammatory factors affecting his cells that you could not see from the outside unless you specifically tested for that. So I don't believe that young people are just dying without any cofactors, because the reality is this virus is not much more significant than the flu. As a matter of fact, the flu itself kills many more people every day than this virus does, okay? But we do know that it's particularly virulent for that age group, okay? So let's talk a little bit more about immune senescence. And this was something that I just discovered this morning at 4:30 in the morning when I woke up with the thought that I should include some information about immune senescence. I started doing research, and now you're getting the benefit of the fruits of my labor from the wee hours of this morning. So immune senescence, what else can slow down our immune system in its function and speed up the death of our immune cells at any age? Well, there's research out there that shows that an infection with cytomegalovirus can speed up immune senescence. So what the heck is cytomegalovirus, you ask? Well, CMV is a virus related to herpes, okay? It's so common that anywhere from 50 up to 90% of adults in the United States are infected with it, and most of the time you have no symptoms, so you don't know it's there. Now, sometimes the CMV can cause mono, okay, just like Epstein-Barr can, mononucleosis. So if you had mononucleosis, you either had probably a CMV virus or Epstein-Barr virus, okay? But the reality is, most of the time you won't know that you're a carrier of it, and just like herpes virus, which leads to things like cold sores, leads to things like chickenpox, we know these things lay dormant in our body, and over time, they start to come out at times of, get this, stress. Is anybody stressed right now? Is the media producing more stress for us every day when we listen to those numbers? Absolutely. So what's that doing? That is increasing your risk of allowing CMV, which is probably already in your body, to come to the surface and create immune senescence and lower your immune function, okay? So the problem with this is the CMV blocks a certain kind of white blood cell called T cells, which are targeting cells. These are the cells your immune system uses to pinpoint the coronavirus, the COVID-19, as the enemy. Our T cells then tell our B cells to go ahead and start making antibodies to destroy that, okay? Now, if cytomegalovirus binds to your T cells and starts to cause them to slow down their function, then your immune system can't respond the way it's supposed to. So the B cells and T cells would normally fight off our pathogens, okay? Now, the problem is when the CMV is taking over, we have a lower quality of both B and T cell, making it difficult for your body to mount the appropriate response to any kind of virus or bacteria. Now, look at the bottom of this. On top of that, levels of inflammation in the body tend to rise as we get older and create a phenomenon known as inflammaging. That's a pretty cool term. Sorry, I didn't think about that. Inflammaging, which means accelerated aging due to inflammation. And as a cellular inflammation specialist, I know exactly how detrimental it is to your body and how it can make you biologically age much faster than your chronological age, okay? So you have to realize that aging is something that can be modified, okay? So we have a certain time that we're on this earth, but how old are we within that time? So we have a lifespan, but within that lifespan, we have a health span. And it's very important to realize that you can modify your health span. How many of us know somebody in their 60s who's decrepit and can barely move, and someone in their 90s who's out golfing every day feeling great? I certainly know that I do. I see that in my patients all the time. So you can slow your biological aging and slow things like immune senescence, regardless of your actual chronological age, which will better protect you against viruses and any other threat. So let's start talking about some of the things that we can do to support our body's immune system and help defend us from this virus. Well, of course, we all know wash your hands, right? We've heard this a million times now, and we've probably seen this floating around the internet. I thought this was a pretty good graphic, and it shows over here what your hand looks like before washing, and the lighter blue represents the virus on your hands. Now, this is after what we call the rinse and shake, or the splash and dash. So you put some water on there, shake them out, dry them off, and off you go. Well, we see that takes off a little bit of the viral material from your hands, which is now represented by the darker areas are the clean areas. Now, if you just use regular little old soap, we see that, I'm sorry, here's 6 seconds with no soap, and we see just the friction takes off more. But if we use soap, we can see the big difference between here and here, as the soap actually helps our body remove the virus. And why would that be? Why just regular old soap and not antiseptic? We don't want antiseptic. Now, the reason we want regular old soap is soap contains something called surfactants and emulsifiers. And what did I say at the beginning of this presentation? That particular coronavirus was a ball of fat. And what breaks down fat? Emulsifiers. So think of dish soap. When you put a dish soap into your greasy pan, it gets that grease right out of there, okay? So as a matter of fact, you'd probably be best washing your hands with a little dish soap because it breaks down the viral fat layer and destroys it, and off it goes. And then the friction actually gets it off your body. So after 15 seconds with soap, we see much better. Look, after 30 seconds, much better overall. So what we want to do is shoot for 30 with soap, maybe even dish soap. What else can we do? Okay, well, again, as we said at the beginning, we can wear masks, and we understand why that is, more so that you don't transfer the virus to someone else. It's not really going to protect you because the virus particles are microscopic and also can get in your eyes, but it's going to protect you from coughing some chunks of virus onto somebody else if you were infected and didn't know it, okay? So that's why they're recommending masks. Now, the problem is people don't quite understand the concept, and they're wearing masks all the time. I see people driving down the street, only person in the car wearing a mask. Who are you afraid of? Why are you wearing a mask in your own car? It makes no sense. As a matter of fact, just yesterday there was a report on the news about a woman who crashed and died because she couldn't get enough oxygen through her mask and passed out. So let's not get crazy about this, okay? What we need to talk about is the best defense is a good offense. So what is going to save you? Washing your hands is important. Is that going to save you? No. Wearing a mask is important. Is that going to save you? No. If you get the virus, what's going to save you? That is your immune system. Your immune system is the system that your body was given, an interactive network of organ cells and proteins to protect you from viruses and foreign organisms. So we want to talk about what can we do to boost our immune system and specifically to stop a virus. So let's go back to that cell again. And this is where it gets really important. And this is probably something you guys didn't know. So we talked about that outer cell membrane, and we talked about the membrane around the nucleus. Now the problem is that that membrane can be interfered with. And I said earlier we're going to talk about 3 ways to stop a virus. Well, first, a virus has to get in the exterior membrane. So if we can stop it from getting in that membrane, we stop the infection. Then the virus has to get through the nuclear membrane. If we can stop it from getting through that membrane, we stop the infection. And then the virus has to get back out the external membrane to infect another cell. So again, we have a second or third chance here to stop that cell. There's only 3 ways you can stop a virus: stop it from getting in, stop it from replicating in the nucleus, stop it from getting out. So how do we do that? Well, let's look at the skin of this cell on closer inspection. And if we take this and bring it over here and blow it up, we see that this external skin is actually made up of 2 layers. These little rods, these little yellow rods you see here, are fats. And then we also see proteins and phosphorus. And we see these little blue guys sticking up like antennas. And those are actually protein structures and something called oligosaccharides that are receptors for the cell. These are actually antennas that your cells use to hear your hormones, to hear your neurotransmitters, to hear your immune system tell the cell what it's supposed to do, how to defend itself, and what its job is. So we want to make sure these antennae are working properly. Now the problem is when these fats get displaced and pushed out and replaced with unhealthy fats, that starts to damage those cell receptors. When these fats get inflamed and irritated by things in our diet, it damages these cell receptors. When it gets inflamed and irritated by toxins in our environment, it damages these cell receptors. And when that happens, our cells start to become deaf. They can no longer hear the signals from the immune system or from your hormones telling your body what to do and how to work and how to protect you. So it's extremely important. What we need to do is make sure our cell membranes are healthy. If your cell membranes are healthy, not inflamed and not toxic, then you can put up an effective gate, a barrier against that getting in, against it getting in here, and against it getting out. So we really, really, really need to focus on this. So what's the most important thing is to make sure that these membranes are made up of the healthiest fats possible. And the number 1 fats those are made up of are omega-3s. I know you've heard that term before, especially when it comes to fish oil. So omega-3s are the best way to create healthier cell membranes and reduce cell membrane inflammation. So how do you know if your omega-3s are up to snuff? How do you know what your levels are? You can eat a lot of fish, you can even take fish oil supplements, but how do we know if that's actually getting into your cells and creating a healthier cell membrane? The only way really to know is to test. The good news is there's a very simple finger prick test, just a little drop of blood that will actually tell us the exact makeup of every fat in your cell membranes. If they're healthy, if they're inflamed, if they're toxic, and exactly what you have to do to rebalance them and exactly what fats you need and exactly what ratios. Now, not only is it made up of omega-3s, but there's also other fats that you've been told not to eat your entire life that make up healthy cell membranes, and that is high quality cholesterol and saturated fat. You actually want cholesterol and saturated fat. They make up every part of every cell membrane in your body. The difference is you want them from organic sources, not commercially farmed animal raised sources. That has a very different chemistry based on the chemicals that was used to treat that animal, as well as what was put into the feed of that animal. So it's a very different process. It's a whole other animal, okay? So we want only organic dairy and meat to get that cholesterol and saturated fat, okay? But we also want our omega-3s, particularly from fish, in order to get that to the level we need for the proper resistance. And if you want to get a cell test done, it's only $99, and that tells you exactly where your resistance is at. That to me is probably the single most important test that anyone can do, because it's the fundamental foundational level of your whole body health. Your whole body is made up of systems. Your systems are made up of organs and glands. Your organs and glands are made up of tissues. Your tissues are made up of cells. So if your cells aren't healthy, you're not healthy. It's as simple as that. So whether you have symptoms or not, you need to know your cell health. In the report that you get back from that kind of test, it tells us all about your omega-3 levels. It tells us about certain inflammatory fats versus anti-inflammatory, about the worst offenders, and about your toxins in your cells. So very valuable stuff. Next thing I want to talk about is food. All right. So we talked about trans fats, we talked about toxins. So, and sugar. In the form of food, the things that inflame our cells the most in our diet has to be sugar and trans fats. Sugar comes not only in the form of sugar, like you would pour into your coffee or tea, or you find in candy, but any carbohydrate breaks down to sugar, and any protein breaks down to sugar. So there's only two sources of fuel in your body: glucose, which is sugar, and fat, okay, which is ketone bodies. That's why you may have heard of the ketogenic diet or keto diet. That's raising the amount of ketone bodies relative to the sugar, so you have a healthier source of fuel for your cells. When we burn sugar for fuel, it's very dirty. It's like burning wood, creates lots of smoke. And what actually creates more damage than the house fire? Is it the fire or the smoke? It's the smoke. What do people die from? The fire or the smoke? From the smoke, more often than not. So when you're using sugar from carbohydrates and too much protein in your diet, and it's converting to too much glucose, you're burning wood, you're creating smoke, you're damaging your cells, you're creating cell senescence and immune senescence. If you have a higher healthy fat ratio, healthy fats, okay? I'm talking about extra virgin olive oil, extra virgin coconut oil, nut oils like avocado oil, almond oil, macadamia nut oil. What you want to avoid are soybean oils, canola oils, not healthy no matter what they try to package it as, okay? Genetically modified oils, vegetable oils of any kind, we don't want those, okay? Don't eat those. They all create cell inflammation. And any kind of trans fat, which is hydrogenated or partially hydrogenated oils, creates damage to your cells, okay? Now, one quick note on the package, a big push that we see in the marketing now, it says 0 grams trans fats in front of that package. Did you know that the FDA allows the food manufacturers to lie? So it can say 0 grams and still actually be up to half a gram of trans fats per serving. And the problem is when you eat that package, you're not eating one serving. Can you stop at one chip? I can't. Okay, if I'm going to be eating that, I'm probably going to eat half the bag. That's probably 2 to 4 servings. So now I've got from 1 to 2 grams of trans fats in my body, and that's enough to cause massive cell damage and destruction. So what you have to do is flip the label, flip the bag, read the label. If you see the words hydrogenated or partially hydrogenated, those are trans fats, regardless of the lie they're telling you on the label. So pay attention to that. So let's talk first about what do we want to get from our food to support our immune system. obvious. You guys know this. We want to get plenty of vitamins and minerals from whole foods. That means food that actually grew someplace, or food from an animal that was fed on something that grew someplace in its own natural environment. Cows are supposed to eat grass, not grains, okay? Chickens are supposed to eat flowers and grass and bugs, not grains. So when we have these massive commercial food mills and we feed these animals all these grains, grains produce more inflammatory chemicals, okay? So now you have meat that's full of inflammatory chemicals. You eat that, you get that along with the antibiotics, the hormones, the pesticides, the herbicides, glyphosate, the active ingredient in Roundup, now sprayed on all the grains, especially in the animal feed. Very damaging to your body, very damaging to your immune system, okay? So what do we want instead? Whole foods, preferably organic, okay? It doesn't just mean it's free of pesticides and herbicides. It means it was grown in soil that was tilled a certain way for a certain period of time to be very rich in nutrients. So you get a lot more of the vitamins and minerals from the food that's grown in the organic soil. For example, the amount of calcium found in 1 cup of organic spinach, you would need 40 cups of commercial grown spinach to equal the amount of calcium in 1 cup of organic spinach. It's a big difference, okay? As we said before, sugar is simply not good for the immune system overall. We know, for example, in the case of cancer, sugar is cancer's favorite food, okay? So even if you aren't dealing with the virus, the more sugar you eat, the more you're feeding cancer cells first. Now, not all foods created equal, specifically because not all of you are created equal. So if you had cellular inflammation going in your body, and that's occurring in your intestinal system, in your gut, that's going to create a syndrome known as leaky gut. Now, leaky gut is when the skin of the lining of your intestines becomes inflamed. And just like the skin on your arms where you have pores where waste gets out, and like say you rub some vitamin E and the nutrients can get in, well, in your intestinal system, you have pores as well, where nutrients get in, but the holes are supposed to be so small that viruses and bacteria and toxins can't get in, and it's supposed to let waste back out, okay? What happens when you have a leaky gut syndrome going on? The inflammation creates pores that get too big. Now viruses get in, now toxins get in, and now food particles that were meant to be fully digested and only as big as my pinky nail to get through that little hole start to drop in to the big hole before they're fully digested. The problem with that is that large molecule size looks a lot like a bacteria to your immune system. So your immune system starts to attack the food, and that creates food allergies and food sensitivities. Now, a food allergy is usually pretty obvious. You eat that food and within minutes, you have a pretty significant reaction. Think of a kid with a peanut allergy and his throat swelling up. But food sensitivities are much more difficult to recognize because the reaction may not occur for anywhere from 1 to 3 days later. And that reaction may be mild. Maybe you got a headache. Maybe your sinuses filled up. Maybe you couldn't sleep. Maybe you felt really fatigued. It could be all kinds of different things. So really the only way to know if you have sensitivities to certain foods that are further burdening your immune system is to do proper food sensitivity testing. And there's different levels of tests out there, and some are much better than others. If you have any questions, feel free to contact me and I can guide you towards what's the best thing to do for you for that. But it's very important to know exactly what you're sensitive to. And this testing gets very specific. It might tell you, you're okay eating broccoli, but not cauliflower. You're okay eating chicken, but not turkey, and so on, because of the immune system's reaction to that. And that's very important to know. Again, when we look at young people who are dying from COVID and we say they had no other problem, I guarantee you they did. I guarantee you they had food sensitivities, creating inflammation, silent, low-level, chronic, long-term inflammation that was damaging their cells and slowing their immune response. That's the only way that someone would succumb to this type of virus. Your immune system has to be weakened. It's not that strong of a virus, but if you're weak enough, it can get you. Let's talk about the gut balance, okay? In your gut, you have a microbiome, which is a balance of bacteria, viruses, fungi, archaea, all kinds of microorganisms that are extremely important to controlling your health and your function overall. 70% of all of your white blood cells for your immune system, your body's army, live in your intestinal lining, because where are most invaders getting in? Through here and through here, which ends up going down that tube, right? So our immune system lives in our gut, and it controls 90% of our entire immune function. So it's extremely important that we have a good balance of the good guys down there, okay? So when that is not right, when the gut microbiota, as they're called, get out of balance, well, that can lead to succumbing to diseases, okay? It can lead to more inflammation. It can lead to neurologic problems. And neurologic problems, what's that? Your brain and nervous system control every aspect of your body, including your nervous system. Including your immune system. So if your gut is disturbed, it affects even your brain connection. And here's that brain-body connection we've heard so much about. That's what I did my undergraduate work in, understanding that brain-body connection. We actually call the gut the second brain, but many people now actually believe it's the first brain because the balance of bacteria there, the DNA there in those bacteria actually communicate with the DNA of the cells in your body and in your brain and make decisions for us and actually tell the brain what to do. So think about that for a second. The bacteria in your body are telling your brain what to do. Who's in charge here? It's really not who you think it is, okay? Actually, when you look at the human body made up of trillions of cells, they estimate that up to 90% of the cells you find in your body are not human. They're microbes. Only 10% of the cells that make up your entire body are actually human, okay? So it's a symbiotic relationship. We feed off each other and give each other benefit. When we live this lifestyle, I said before, we don't want antiseptic soap, okay? The reason we don't want disinfectant antiseptic soap is because when you put that on your hands, you're not killing the virus. Remember, antibiotics can't kill a virus, only bacteria, and they're not actually alive, so you can't kill them in the first place. You got to break them down and get rid of them. And regular soap does that better than anything else. But what antiseptic soap does is actually kill off the good layer of bacteria that always live on your skin. You have a skin microbiome that's protecting you from bad guys getting in, okay? They take up all the real estate, so bad guys can't pitch a tent anywhere. But when you use all this antiseptic stuff, all this antibacterial hand wash, you're wiping that all off, taking away your defenses, leaving the campground open for anybody to come camping, okay? And that's why we're seeing more and more people who are washing their hands a lot, all of a sudden getting these fungal infections, especially under your rings, because the fungus that automatically already lives there can now take over, because while the cat's away, the mice will play, right? So important, just soap and water. Get away from the antibacterial stuff. Okay, yep, that's me. Okay, now the reason I threw that in there is not just because it's fun, but because we were talking about the microbiome down here in our gut, and we obviously know what the end of the tube is that way. What's the end of the tube the other way? It's our mouth. This is the other end of the whole digestive tract. And just like you have a gut microbiome, you have an oral microbiome. And this is where your immune system actually starts. When something first gets in here, we go right to work on trying to defeat that, either killing it right here in the things that we have in our saliva to do that, or by triggering an immune response for the rest of the body to say, be on high alert, here it comes. Now, the problem is, notice how nice and gleamy white my teeth are in this picture, because I've used tooth whitening toothpaste. Well, tooth whitening toothpaste that contains hydrogen peroxide actually kills the good bacteria that are trying to protect you. Using a toothpaste that has ingredients to kill the bacteria that causes bad breath also kills the good bacteria that are protecting you. Okay, they're not specific. They kill it all. That leaves you open to more infection and actually more heart disease and more brain disease, even dementia and Alzheimer's, because the bacteria in the mouth that overpopulate when you get rid of the good guys start to secrete chemistry that changes brain function, creates inflammation in your brain cells, and creates inflammation in your body. Okay, very, very scary stuff. So the best thing to use for your oral health are things like charcoal-based toothpastes, okay? Even just friction on a toothbrush with no toothpaste would be better than using teeth whitening or the toothpaste that contain antibacterial agents, okay? So what else can we do? Well, we can use nutrients to help protect us, and specifically, there are herbs that are known to be antiviral, and they work to either stop it from getting in the cell, stop it from getting into the nucleus, or stop it from getting out of the cell. So there are very specific herbs that are very good at that. One of those is echinacea. Another one is elderberry. Now I want to put a little note of caution in here, because we know that this particular virus creates an overreaction of your immune system, something we call a cytokine storm. You need to be aware that elderberry works by upregulating your cytokines, kind of giving your body a little boost to get your immune system going. Now, if you already have symptoms like a dry cough and you think you might have it, do not take elderberry at that point, because if you're already creating an increased cytokine reaction, the elderberry could actually upregulate it. So it's very important to, if you think you have symptoms, only take echinacea, do not take elderberry at that point. Up to that point, elderberry is probably the best thing you could take because it stops all three ways in which a virus can attack us. All right, so I take elderberry every day myself, and I think it's a great thing to use unless you have symptoms already. Now, there are 10 top immune boosters. I'm going to go through these very quickly, and I'm not going to cover these in detail, but the list is actually in detail in this whole presentation. But I don't want to waste time on it right now. You can get a copy of this presentation at the end, and you can read through all the stuff on your old time. But here's the echinacea elderberry. Colloidal silver also is naturally antibacterial, antiviral, and antifungal. Probiotics to help rebalance the better, healthier microbiome. Astragalus root is what we call an adaptogen that helps your immune system adapt to stresses. Ginger, anti-inflammatory. Ginseng helps the whole body, is what we call a whole body tonic. Vitamin D, as we know, is an immune booster. Myrrh and oregano. Think about, what did the three wise men bring to Jesus, right? Frankincense, gold, and myrrh, right? Well, what's frankincense? Frankincense is an anti-inflammatory essential oil, and it's great for helping your immune system, okay? What's gold? Technically, we actually don't think they actually brought physical gold. We think they actually were talking about a golden color herb called turmeric or curcumin, also highly anti-inflammatory. And myrrh has been found to be anti-inflammatory and support your immune system. So what the three wise men were bringing to Jesus were the three things they knew help maintain the healthiest life. That's what they wanted to bring to the baby. That sounds pretty cool, doesn't it? All right, so I'm going to skip right through all these. We're not going to go over these right now. We're going to fly right through that. Okay, so the next thing I want to talk about is exercise. So we know we want proper vitamins and minerals. And again, you can read that list on your own time. The next thing I want to talk about is the importance of exercise, okay? And it has been found in studies that the immune system cells will increase in both their number and their ability to fight off when you do regular exercise because it reduces inflammation, okay? Now, they specifically studied the case of riding a bike, whether it be an exercise bike in your own home or out on the street. We have found that when you ride a bike, it dramatically increases your immune function. So good to know. Now, the problem is you don't want to overdo it, because when we are too sedentary, anyone being sedentary right now during quarantine, by the way? What's this guy doing? Okay, sitting on the couch eating cheeseburgers. That look familiar to anybody? Anybody hear the quarantine 15? So what's happening is right now, being sedentary is one of the worst things you can do for your immune system. That actually raises your risk of upper respiratory tract infections and of the coronavirus getting into your lungs. So we want a moderate amount of exercise. What does that mean? Get out and even just walk for 20 minutes a day. That's all you gotta do. Now, if you really push it and you overexercise, figure a little's good, a lot's gotta be better, well, then you're going to actually overtrain. When you overtrain, you cause your immune system to go kaput again, okay? So we don't want to undertrain, we don't want to overtrain, we just want some moderate exercise in there. Next thing I want to talk about is maintaining or getting to a healthy weight, and that's where both diet and exercise play a role. But the most important role in our weight is actually inflammation. How many of us know that when we're carrying excess weight, we may eat the healthiest foods we know, we may even eat so little, we eat like a bird and we exercise like a dog, and still we can't lose the weight? That's because your weight's actually controlled by 15 different hormones, okay? 10 from your body and 5 from your brain. And inflammation to your cells disrupts the ability for the cells to hear the hormones. So you can be eating all the perfect food, exercising just right, and still not lose weight because the inflammation's blocking the body's ability to use your hormones to burn your fat. So the most important thing to maintain and get a healthy weight is control your cellular inflammation. Number 4, quit smoking. Sounds obvious, right? We know number 1 is not good for your lungs. So obviously in this situation, we know anything that stresses our lungs is going to amplify the ability for the coronavirus to kill us, okay? But smoking also contains chemicals that create more inflammation, not just through the airways, but throughout the entire body. We keep cycling back to this whole inflammatory cellular kind of theory here, right? Number 5, you want to manage your stress and emotional health. Now, this is probably one of the single most important things I can get across to you for this entire presentation, okay? Your stress level directly impacts your emotional health, right? So it's very hard to stay happy and upbeat when every time you turn the TV on, you're hearing all about the horror in the world, right? So what does that do to us? Well, in my undergraduate studies in psychophysiology, I learned all about how that stress dramatically lowers your immune function, dramatically lowers your immune function. The more anxiety and stress you have, the lower your immune system will be, regardless of your diet, regardless of your supplements, regardless of your exercise. This is the strongest impact over anything else because it completely changes your body and brain chemistry, okay? So as a matter of fact, in psychology today, they talked about coronavirus is much worse than you think. And why? Because it's infecting your mind more than it's infecting your lungs. And what that does is affect a system of the body called the psychoneuroimmunology system. Psychoneuroimmunology talks about how the mind affects the nervous system and affects the immune system. Also, we have psychoneuroendocrinology because it also affects the hormone system of the body. These are all intertwined in delicate balance. Anything that affects your psyche, like stress, will affect your nervous system's ability to communicate, will affect your immune system's ability to defend you, and will affect your hormone system's ability to communicate. And it works like this, okay? We have a stressor that comes in. Let's talk about emotional stress. The emotional stress creates anxiety, depression, insomnia. Anybody experiencing that right now? I know quite a few people who are. And what does that do? That interferes with our neurotransmitters. It creates more of those cytokines. I was talking about how this is causing a cytokine storm, really blowing them up. That causes problems with your immune system, leads to more inflammation, more infections, okay? This also affects neurotransmitters and hormones, and that is impacting your thyroid gland, your adrenals, and your gonads, okay? It's going to affect your metabolism and your weight gain, your ability to handle stress, and your performance in the bedroom. I don't know about you guys, but I'm hearing every day people telling me I'm gaining weight, I can't stop being anxious, and I have no sex drive after the result of being quarantined and having all this high anxiety. We're also not getting exercise. We're also eating like crap. We're not getting sun exposure for vitamin D, which is paramount to proper immune system regulation, okay? You gotta get outside. You have to exercise. You have to eat healthy organic foods. You have to stay calm. You have to meditate. You have to do things that help your body dissipate that stress, including things like sex, okay? So do whatever you're able to do to dissipate your stress. So that's the psycho part, okay? Now let's talk about how that affects the immune system just a little bit more. Studies have shown even short-term stressors, like making a speech, can lower your immune system response in as little as 5 minutes. How long have I been talking now? Crap. Okay, so we also see that if you continue to have that stress over a long period of time, it's going to dramatically suppress your immune system. But we see a lowering of your immune system even with having a significant stress at just one point, such as the last 4 weeks. So we see that initially the way our body responds to a stress is it ramps up a healthy response. Our immune system starts to drive up. It's fight or flight. We might have to fight something, so we better get the immune system stronger, right? That which doesn't kill you makes you stronger. But what if that stress persists? Well, then you start to drop into the chronic stress category, which is when it lasts over weeks, and we start to drop into a state of immune decline, immune senescence. That's the case where the stress does kill you. So acute stressors upregulate the immune system, increase the strength. Chronic stressors downregulate and create immune suppression. All right, so let's talk about the neuro part of it. So that was all about the psycho. What about the neuro? We said before that your brain and spinal cord control and coordinate all the actions of your entire body, including your immune system and your hormone system, right? Your ability to fight, your ability for the body to communicate. So how does the nervous system work? Well, your brain sends information down through your spinal cord, which is the main information highway connecting that information to every part of your body, including that gut. So we have this two-way communication going up right through that spinal cord and through a nerve right in front of your spinal cord called the vagus nerve. So we have to have all this open for communication. Now, if you have any stress or misalignment in your spine, or the way your head sits on your neck, or of your hips, that creates a little bit of short circuiting throughout your nervous system, all along the whole line of this information superhighway, kind of like creating roadblocks and potholes and blocking exits on the highway. So when that happens, that's going to decrease your nervous system's ability to control your immune system and your hormone system. For that reason, I do recommend that everybody get chiropractic care. That's why I'm considered essential. That's why I've been in my office 6 days a week. I've never taken a day off during this entire crisis, because what I do helps to improve health overall, increase your sleep, decrease your stress, right? Improves your stress, increases your immune system, decreases disease, illness, depression, anxiety. Sounds like a prescription for health to me. Now let's talk about sleep a little bit more, and we're getting right to the end of our presentation now, so thank you for bearing with me. Why is sleep so important? Well, during your sleep, you actually go through a process we call brainwashing, and that's when your brain actually cleans itself out of toxins that are causing inflammation in brain cells. So the longer and deeper we sleep, the more of this occurs. That's why they say 7 hours is ideal, because not as much happens at 5 hours, not much more happens at 8 or 9 hours. So 7 hours is really where we want to be if you can get it, and that's going to clean those toxins out of your brain, physically restore your brain function, and strengthen your immune system. Our immune system is closely tied to our sleep, because when we're sleeping, we release certain disease-fighting substances that are incorporated into hormones and proteins that fight off disease and infection. So during our sleep is when we're doing most of our healing. Think about when you're really sick, what does your body want to do? It wants to curl up and take a nap, right? Because when you're sleeping is when you're actually doing the most healing. You feel completely fatigued, like you can't even get up. That's because your body's trying to sleep and heal. And what do? Dummies that we are, we power through it and fight past it. No, give in, sleep. This is a good time to actually get some extra sleep. So keep in mind that the coronavirus is currently being blamed for the deaths of vulnerable people, especially seniors, but they may also be suffering from other problems that's actually really killing them. Going back to the beginning, the numbers we're hearing every day, we should not freak out about, because these are people dying from COVID and with COVID, and it's many more with COVID. The virus itself is not as bad as you think it is, okay? But what is bad is giving into all the stress and anxiety that is being produced. You have to keep in mind that over 80% of all cases, 8 out of 10 of us will have a very mild case, not realizing we even have more than a cold or even no symptoms at all, okay? 8 out of 10. Now, I'm not saying that that makes it any less significant that people are dying from it. Of course they are, and I feel horrible for those people who are dying from it and for their families. But the reality is, the more you stress about it, the more likely you are to die from it. But in closing, don't worry. A little bit of a joke. I'm not trying to be racist in any way. That's not what I mean here. A little joke. The coronavirus won't last long because it was made in China, right? So let's keep in mind that hopefully this will pass quickly. Hopefully we'll all be getting back to work and back to our normal lives within the next weeks to months. And in that exposure, getting back to reality, we'll actually be able to develop an actual immune response. There's a big problem with this severe, strict lockdown we've been on, because the only way your immune system actually derives those antibodies from those T cells and B cells is if you have exposure. If you don't have exposure, you cannot mount an immune defense. So everything I taught you here was how to strengthen that defense, but you can't mount the defense in the first place unless you have something to mount the defense against. We must have exposure. Therefore, it's my opinion that we need to have more of a spigot kind of approach, quarantine on and off, or a targeted quarantine. Really quarantine those people who are most susceptible, the ones we know are susceptible, the elderly, the immunocompromised, and let the rest of us take the active steps to strengthen our system and mingle a little bit so we can develop what we call a herd immunity. 60% of the population has to develop antibodies through exposure to ever develop a herd immunity. If we don't, what's going to happen? Guess what? We're going to have the dreaded second wave come the fall because we were all locked in. No one developed immunity. The virus is actually mutating and alternating itself for the purpose of survival. So when we come out of our homes, now we have multiple more strains to deal with and no immunity at all. So get out, okay? As soon as your governor allows you to. So if you would like more information about what I was talking about, if you'd like a copy of my presentation, including the slides that I flew through, if you would like a list of targeted antiviral supplements that I give to my own patients and a resource where you can order them online and actually get a discount that I get on them, I'll send that information to you. Just send an email to me at advancedhealthrestoration@gmail.com. And in the subject line, all you have to do is put your name and put down the word copy if you'd like a copy of this presentation. Put the word list if you want the list of antiviral supplements and immune boosting supplements that I find to work best. And put the word test if you want more information about how to get that cell health test to tell if your cells are actually inflamed already and if you have to work extra hard to keep your protective levels up. And if you want more information about anything that I do or just want to shoot me a question, you can go to my website, wildwellnessconsulting.com, which is the website I devote to my functional medicine practice. I know I went a little bit over. I apologize. I think I probably spoke 45 minutes, but it was a lot of information to try to get in. I hope it was valuable. I hope you learned something. And I hope that you have a wonderful, healthy day ahead.
Thank you. Thank you so much, Dr. Wild. Thank you for all the information. I mean, it was really good. I did make some comments on the chat section, so you can see through it. But like you mentioned, some points on the media and stuff, I completely agree with you. I think we need to start thinking more positive and things like that. And before I leave it for questions, guys, I wanted to mention about Dr. Wild's websites. There are links to it. The first one is www.thebiohack.zone. The second one is, he already mentioned, www.wildwellnessconsulting.com. And also the third one is www.wildchiropracticcare.com. It's all under one roof, but 3 different websites. His clinic is off of Patterson. if anybody needs any guidance or something, please feel free to contact Dr. Wild for all your information. Any questions, anyone?
So I do see a couple of questions popping up in the chat, so I'm going to start addressing those. If you have another question, go ahead and put it into the chat. Susan, you were asking about the omega-3 test, and you can get that test. It's not run by any particular one lab. There are many labs that run it. I can also mail that test kit to anyone. Very easy to do. So if you want to get that test done, I could very happily just mail it out for you to wherever you want to go. If you want to buy it for your mom, kind of thing, because I know sometimes I tell my parents to do things and they don't do it.
Yeah, your mom is still watching, so.
Yeah, I know, exactly. That's why I said that, right? I say hi, little Joey. It's my mom. Okay. Sometimes I have people come to me all the time and say, hey, I really want this test for my brother in California. Well, you can purchase it for him and send it to him, or you can refer them to my website, and you can actually purchase that test directly through my website, and I'll mail it right out to you. It's $99. All right. Micheal, you were asking about immune senescence linked to lowered HGH. So the interesting thing about that is that our endocrine system is what we call a closed system, meaning imbalance in one hormone is going to affect in some way all others. Now, there are certain hormones that really balance themselves or each other more directly. So, for example, your thyroid hormone balances directly with your sugar metabolizing hormone, insulin, as well as your sex hormones. And, okay, of course, now I'm blanking because I think I have lower neurotransmitters in my brain, right? Stress hormones, cortisol, okay? I must be stressed. Okay, so human growth hormone and testosterone go hand in hand, okay? And those are your two primary fat burners and your two primary tissue repairers. So your immune system is using human growth hormone and testosterone primarily to repair damage to cells that have occurred during the day. And those hormones get released during the night in your deepest part of your sleep cycles. So each of our sleep cycles go 90 minutes. And we want to try to have, hopefully at least 4 of those sleep cycles a night, okay? And in that bottom part of that 90-minute curve is where the testosterone and human growth hormone gets released to do the healing repair during the sleep. So if you have low HGH, you can't repair properly, okay? So that is a form of immune senescence, if that answers your question. All right. Any other questions?
I don't see anybody. Okay.
That means either I did a really good job and I answered all your questions, or you just want me to shut the heck up and go home.
I have a question.
Yes.
You were saying that it's a good idea to get back into a group situation to a certain extent.
Right.
Like, because I happen to be Mike knows this, a permanent sub in a school district. I'm concerned about going back to school in the fall because that's going to be a group situation.
Right. So what I'm talking about there about be a good idea for us to start mingling again is for people who we know are in a healthy level of cellular inflammation and are not immunocompromised and not particularly older, like over 80, because we know that those situations, okay, are going to lower your immune function. So if you're concerned, the number one thing I would do would be that cell health test, because if your cell inflammation levels are fine, that's a good indicator. Other tests you can do to look at your immune function are regular blood work tests that measure things called CD4 and CD8 cell counts. Also something called Th1 and Th2 balance. These are all different tests that can be run by a lab that tells you more about your proper immune system modulation, okay? We usually see an imbalance in CD4 and CD8 counts when someone's really immunocompromised, such as with human immunodeficiency virus, HIV, okay? Right. But it doesn't have to be something that bad to be immunocompromised. It starts somewhere, right? The Th1, Th2 balance, we usually see that issue when we have an autoimmune problem, where your immune system is attacking your own tissues, which can stem out of that food sensitivity I was talking about earlier. So if your body becomes sensitized to certain food particles, then that food becomes part of your tissues because you are what you eat, right? So that food becomes your cells. Now your immune system attacks not only the food, but it attacks wherever that food became. So if it attacks your thyroid, that can develop hypothyroidism. If it attacks your brain, that can develop dementia. If it attacks your heart, that could develop pericarditis, right? If it attacks your other organs, that could be involved with lupus, your spinal cord, MS. So there's lots of different things that this can cause that come from a common source, which is inflammation at the cells and the balance of the immune response. So those are blood tests. So if you got those tests done and everything was fine, I'd say you're probably okay to go ahead and go back and start mingling with people because you're not particularly weak. Now, even if you were 20 years old and those tests show that you were not fine, I would not recommend that you go mingling. That's where I'm talking about that targeted quarantine where we protect those who are weak. Well, first we have to find out who is weak. So you have to do the right tests.
Excellent.
Any other questions?
Dr. Weil, this is Arvind. Let me put on the video too.
Okay.
Yeah, hi.
Hi.
Hi. Your presentation was fantastic. It had a lot of information. I hope you share the slides with us. You covered a lot of topics, but I just want to revise it. I found it very useful. So one question I had is like a little more from a very practical standpoint. I know that the fear of not going out or mingling is going to be consistent or could be a new lifestyle for the next several months.
Right.
As a regular person who has to go to work or have to go do groceries and stuff like that, what are some basic things that you would recommend for a person who goes out at least 2 or 3 times a week? What are the things that we should take care of other than washing hands every now and then?
Okay.
Precautions that we should be keeping in our minds.
So one thing that you can do to help protect yourself and raise your defenses, and I skipped over this really quickly because of the time factor, but getting back to those nutrients, okay, there are certain vitamins, certain minerals, certain herbs that are really more important than others in not only boosting your immune system, but being particularly antiviral. So if I were to supplement and support my system, vitamin D is the most important vitamin for that, okay? And vitamin D, by the way, is misnamed. It's not a vitamin at all. It's actually a hormone. But they never changed the name. So it's a communication tool for your body, and it regulates a vast majority of your immune function. Now, of course, we know how important vitamin C is as well, right? But if I had, and vitamin A, all for immune function. But if I had to choose one, I would choose vitamin D, okay? From a mineral point of view, you guys may know that zinc is very important to immune function, and we hear a lot in the media about the combination of certain drugs with zinc being successful in helping fight, because zinc activates the immune system as well, okay? And it also helps to cut the legs off of viruses so they can't replicate. Now, zinc is important, but even more important than zinc is selenium. So selenium stops all 3 of those viral points from getting in the cell, getting in the nucleus, and getting out. Selenium stops at all 3 places. So selenium is even more important than zinc. When it comes to herbs, again, elderberry and echinacea, unless you already have symptoms, then just echinacea, okay? Now, there are other herbs you can certainly add to that. There's a whole family of adaptogenic herbs like astragalus, ashwagandha. Those are fantastic. But again, if we're trying to figure out what's the least I can do for the most protection, these are things I'd recommend, okay? And then the biggest thing is your diet. You can't out-exercise and you can't out-supplement a bad diet, okay? So, and in diet, again, sugar and trans fats are the most important things. If I had to say, just watch out for 2 things, that would be it. Of course, it can be more than that, but again, I'm trying to keep it simple.
Thank you so much. Thank you.
Thank you. Anyone else with any questions?
Going once.
Twice and third. All right. So once again, thank you, Dr. Weil, for your time and a great presentation. Appreciate all the good information. Once again, for everybody who has missed this presentation, your friends, you want to see it again, we will be posting this under a page on Facebook called Weekend Wellness. And I will also try to get the slides from Dr. Weil eventually.
I'll send them to you as soon as we're done.
Yes, and once it is done, and we'll what I'll do is I'll post that also on the Facebook page. If anybody needs any questions, you know how to reach Dr. Weil. I've given you all the information, and his phone number, your contact information is going to be there, right?
Right.
Just,
so that last page of the slide, and I can put that back up if I'm okay to share my screen again.
Fantastic. Just leave that for a little bit, so that way people can write it down. And
so what you want to do?
I took a screenshot.
Email.
You took a screenshot. Okay, excellent, excellent. So There you go. So tomorrow we are going back to 4 o'clock. Dr. Raju is presenting from St. Louis, Missouri on food and health. Once again, an interesting topic. And she's going to correct your misconceptions about food, what is healthy, what is going to make it healthy, and what effects food has on our body and everything. She's an endocrinologist, and she has her own practice in St. Louis, Missouri, and she's going to talk about all those tomorrow at 4 o'clock. Please do join in, and please spread the word to your friends. This is a free service. The goal is to educate people as much as we can during this quarantine, because a lot of times we hear from media, all we hear is bad things. We don't really hear anything good, except in between for 2 seconds they'll mention about something good and they move on. So we don't, I mean, on a normal day from media I have seen is somebody kill someone, or breaking news. I don't hear that. It's breaking news is basically number of COVID patients. And after your presentation, actually, I hope people will start looking at different things, So don't listen to media all the time. They are just making our minds only think about bad stuff and fear. So other than that, if you have any questions, please reach us. And thank you once again, everybody, for all your time. Thank you.
Thank you. Excellent.
Thank you. Thank you.
Loved it.
All right, sign off.
Yeah, all right.
All right.